So I am Marilia. I did my project on liver cirrhosis, and in 1761, the doctor John Batista was the first one to identify the transformation in the liver, and then 1826 they gave a name, like cirrhosis means orange in Greek, and almost 100 years later they made an advanced theory. So before I get started, we remember the liver functions. Liver is a really important organ in our body. It receives two different sources of blood, and many of our substances are transported through the liver and get modified there. The description is: fibrous tissues replace normal and healthy liver tissue by blocking blood flow and prevent it from work. Cirrhosis is not more than scarring of the liver. Here is the picture that shows how bad it gets. So the symptoms are loss of appetite, nausea, indigestion, vomiting, weight loss, fatigue, abdominal pain, fever, and yellow of skin or the eyes. And the disease that develops slow, so it's pretty hard to find in the beginning, which makes harder to help in the future. The diagnosis is the doctor can touch the liver region and see if it's harder, or the blood test that can see if you have hepatitis yes, hepatitis B or C, that makes it's one of the cause, or surgery when the doctor is able to see the liver, or some exams like the ultrasound. The causes pretty common are alcohol abuse and hepatitis, and some not commons like a disease called Wilson. The prevention is limiting alcohol consumption, protection from hepatitis, and try to keep your weight in the normal range, because when you have overweight, you makes your liver work more and then makes harder for your disease. The treatment is, most of the treatments are made to stop and slow the damage of your liver, and if the cirrhosis is caused by alcohol, the patients should stop drinking. Cirrhosis caused by viral hepatitis may be treated with antiviral drugs, and a low salt diet is also essential. And this will depend on how damaged your liver is, because if it's too damaged, you're gonna be in the wait list for a transplant. And the treatment, when it's not too damaged, is pretty much to try to stop the fibrosis. And living with the disease. Liver is the second most important organ. So if you have this disease, you have zero chance to be a healthy person. And life expectancy with cirrhosis will depend of the damage. If discovered early, you have more chance to live with it, because there is no chance to cure, to repair what you have done, but you can stop the progression. And this disease is accounted for approximately 80% of patients on the liver transplantation wait list between 2004 and 2013. The article that I read is pretty interesting because they talk about okay, I will not try this name, HCC, and this HCC may cause liver cancer, but if the person has the cirrhosis and with this HCC, they may live longer. So this article is interesting because it's something bad, but if they can compensate that, they will probably live longer. And then I will show a video that shows how bad the liver can get. Okay.
Is a cross-section of a normal liver. There it is on camera. You see how its architecture is relatively intact, the color is relatively homogeneous. This is, would you like to hold it all? Yeah.
That's a real liver.
That's a real liver. That is somebody's liver, so let's be respectful of that. So this is what a healthy liver should look like. Terry, do you want to hold it?
Sure. I could just say I've held a human liver.
You see that?
Wow.
Okay, so that's, again, particularly notice that the architecture is uniform and the color, and there's a homogeneous quality to it, okay? This now is going to be a cirrhotic liver.
Oh, wow.
Yeah. And these are all regenerative nodules. The liver is full of scar, and it's attempting to regenerate itself, and as it regenerates, it comes up against scar and forms more scar.
How long does this take?
To develop? Mm-hmm. Well, women are at about a 5-time greater risk of developing this. Well, no, it's not the size. It's that you actually lack an enzyme in your stomach to break the alcohol down into a safer compound. And essentially, every woman I've treated that drink like either of you do has some degree of alcoholic liver disease. It's not possible that you don't have alcoholic liver disease. I can't say that you have cirrhosis. Not everybody gets cirrhosis, but I worry that you are at risk for cirrhosis. This is a mess, right? This is probably somebody who died of cirrhosis. And what happens is that not only are you unable to take toxins out of your system, and it can affect your brain, and you can become what's called encephalopathic. You can't build proteins normally. You can't fight. Your immune system doesn't work normally. Blood backs up behind the liver, and you actually develop varicose veins in your esophagus. They rupture, and you can bleed to death in minutes.
And then myroxidine. Done.
That's it?
Yep.